Thank you, Mr Speaker. I rise this morning to make my contribution on this matter of public importance in regards to a facility in my own electorate of Bass, a facility that not only serves our community but of course has a responsibility across much of the north of the state for not only members of our community that need to access health services, but of course the many people in our community that go above and beyond day and night, often days and nights, in a row to serve our community as health professionals, and at the moment are just struggling under the pressure. When you wake up and you see an announcement that people are being encouraged not to attend the hospital because they fear their capacity to deliver great care to our community, you have to wonder just what's going on. I mean, this is beyond a crisis. These are dire circumstances where people in our community are being told, you know, despite all the best efforts of people working in our frontline services, our nurses, people providing care in our community, they're just not going to be in a position to be able to provide that care if you attend a hospital. With pressure on the ED, with sustained staffing shortages, with bed block and ambulance ramping, the time has passed to having staged, considered responses. Right now we need to have a government that is making absolutely committed and priority actions to support our community and also those people working in our community to support the healthcare needs of people of Launceston, of Bass and of Northern Tasmania. As our Shadow Minister for Health mentioned earlier, at the LGH in Launceston, we've got the worst bed block in the country. There are so many things in the history of Launceston that we've been so proud of, that we are the greatest at, that we are the most at, the best at, but to have the worst in the country at anything, in our healthcare, is something that needs the attention, the immediate and robust attention of this government to address. The patients are being turned away, that staff want to provide care and they can't, is a real reflection on this government, its ability to deliver for Tasmanians. There was a comment this morning in response to a question that I just wanted to address. The Attorney-General said something about we always deliver on our promises. We always deliver on our commitments. You would think in that role that only ever being truthful in comments would be important in the Parliament, but people of Bass know that this government don't deliver on their commitments. There was a signature, as our Shadow Health Minister said, there was a signature announcement in the last election, $580 million for the second stage of the master plan of the LGH. Now, I've been across budgets and budget commitments and elections for a really long time, having started at the Launceston City Council over 22 years ago, so I know my way around a budget, and I was gobsmacked to see the budget papers after this massive announcement on the eve of an election that you open up your papers and there's a line and it's got 4-year forward estimates, dash, 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 dash. You would never get away with that at the City of Launceston, of making an announcement for a massive commitment in a community and having $0, $580 million announced for this big project to bring in the votes, but then you have dash, 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 dash. And that means $0 committed in the budget in the 4-year forward estimates for that project to be delivered. Now, that election was a while ago, early of course, so maybe it's going to take the government a little while to get their act together on that, but you can't make commitments to a community and not follow up and then expect them to think that hearing we can't come to the hospital this week because we're not going to be able to look after you is okay. It's a bit like the commitment around the Tamar Bridge, it's a bit like the commitment about the dredging. When are these things going to happen? Our community need to trust that a government will deliver on its commitment, and at the moment there is no trust or confidence in the government that they would deliver on their commitments. In response to the announcement yesterday that people are being discouraged to attend the LGH, there's a whole range of comments on local social media feeds and things, and on my own feed, a member of our community this morning said it's really scary. Any of us are an accident or a diagnosis away from seeing the disaster from the inside. Anecdotal, I know, but talking to nurses, a lot of them are fed up with double shifts and feeling guilted into working extra hours because of the lack of resources, and so many are wanting to change their career entirely. If we have people walk away from this career, we're already struggling to get healthcare professionals in our community. We already struggle to get the people to deliver the support that we need in our community. We can't afford for this to continue. We can't afford it for our workforce, and we can't afford it for our community. We know there's challenges. We know that we've got a small population, really dispersed, but one of the biggest challenges is that we've got an ageing community. Now, I know the Premier, the Minister for Health, announced this morning $150 million will be in the budget for digital innovation, and suggested that perhaps on this side we don't believe in innovation. I've got to tell you, I'm one of the strongest supporters in Tasmania about the potential of innovation for our state. However, when you can't get the basics right, you can't cream on top of nothing with innovation. So we need to make sure that the basics of the services, the support for our healthcare workers and the support for our community is delivered through the Launceston General Hospital. There was conversation this morning, comment about wanting to work with the new Labor federal government, which is fantastic. Labor get what is needed, and thank goodness on Saturday, Anthony Albanese, the now Prime Minister, committed to delivering medical healthcare clinics, urgent healthcare clinics across the country, and particularly one in Launceston. This is going to make it easier for people to attend when they have things that don't need to go to the emergency department, and that'll be great because it will take pressure off. But we have needed these sort of responses for a really long time. Labor's also committed, of course, to cutting the cost of medications and to supporting nurses, to supporting the mental health of the people seeking to support our community. So it's really not good enough that we have a facility to deliver for Northern Tasmania that can't take people at the moment. He's recommending it, is encouraging people not to attend. What I do want to do, though, is finish on a positive note and say that after many, many years, with the support of federal Labor, we are going to be able to provide a hospice in Northern Tasmania, which will again take pressure off the ED. But this government need to get the basics right at the LGH in order that our healthcare workers can deliver for the community of Launceston and Northern Tasmania.
Time has expired.